Thank you, Governor. Good afternoon, everyone. I hope that all of our viewers had a nice weekend and that all the dads in Rhode Island had a nice Father's Day. I will keep things on the brief side today and start with an overview of the numbers. We're in a good place when it comes to new cases as of today. We have 25 new cases to report. There were 60 new cases reported on Saturday and 36 new cases reported on Sunday. Given that we have seen days with new cases in the 400s in one day, these numbers are a good news story. Our hospitalization numbers are also down. Our number for today for people currently hospitalized is 106, compared to the 111 people currently hospitalized for Saturday and the 107 people currently hospitalized for Sunday. These numbers have not been this low since early April. There are currently 18 people in the intensive care unit across the state, and 15 of those 18 people on a breathing machine, which we call a ventilator. Sadly, we do have 5 new COVID-19 associated fatalities to report for today. Our numbers of cumulative fatalities rose by 9 since our last data update on Friday, because we had 2 new fatalities confirmed on Saturday and 2 new fatalities confirmed on Sunday. Of these 9 Rhode Islanders, 2 were in their 50s, 1 was in their 70s, 2 were in their 80s, 3 were in their 90s, and 1 person was older than 100 years old. Our deepest sympathies are with the families of these beloved Rhode Islanders who have passed. And before passing things back to the Governor, I just want to finish with reiterating the importance of the shared responsibility. We've talked about the teams of people working on behalf of the Governor to make sure that everything is in place to keep Rhode Island in the forefront. All of the people that are working on contact tracing, all of the people that are helping us achieve what's been shared. We've tested the equivalent of 20% of our population. All of the inspectors from Department of Business Regulation, from Department of Health, Rhode Island Department of Health, from Department of Environmental Management, and others are all out there helping to ensure that Rhode Islanders have what they need. From that shared responsibility standpoint, it's to be able to say that we believe in you doing your part as well. It's in addition to those teams of people, we can rely on you to make the decision to carry the cloth covering with you, to make the decision to stay distanced, to make the decision to turn away if you see a crowd. With kindness and understanding, do your part to help all of us as Rhode Islanders stay ahead in the forefront. That's something that we can do together, thinking on the positive. When we look at what our communities like Central Falls and Woonsocket have done, the percent positivity has decreased to the numbers that we need it to go in that direction. That's something strong, that's something positive. It shapes the resilient Rhode Island that we want to move towards. And we want to encourage everyone to continue to do their part to help us get to where we need to be. We want to continue to educate you on the risks that are involved. And as the doctor here, it's my responsibility to help ensure you understand why. The science of the virus, why the masks work, why the distancing is important, so that when you're out there and it's a beautiful summer day and you don't want to think about it, you understand that it does make a difference when you apply these tools that we've worked so hard to give you. So thank you in advance for continuing to keep Rhode Island in the forefront, and we'll